Today we will discuss the chapter 10 from second year D pharmacy pharmacology subject. In that, the estrogen hormone. Estrogen hormone, it is a steroidal hormone associated with the female reproductive organs and is responsible for developing female sexual characteristics. Means it's one of the steroid type of the hormones and mainly responsible for the female reproductive organs development and the female sexual characteristics. Now, where these are produced, it mainly produced by the ovaries, adrenal glands, fat cells and the placenta. Among these, ovaries are the main makes the estrogen in a more amount than the adrenal glands and fat cells. And after the conceiving by the woman, hormones that is estrogen can be produced by the placenta more. Estrogen is a hormone produced mainly by the ovaries in the woman, and as well as in the lesser extent it can be produced by the testes in the men also. Now let's see its physiological role. Development and maintenance of the female reproductive organs and its functions, means this is responsible for the maintenance as well as to do the functions of the female reproductive organs. And you know that the female reproductive organs main parts are the uterus, fallopian tube and the vagina. So for the development and the proper function of the uterus, fallopian tube and the vagina, this estrogen play the important role. The next physiological role, that is development of the secondary sexual characters in the female. The secondary sexual characters in the female that can be seen during the puberty time and during the pregnancy time. That the first characters is the growth of the breasts, distribution of the body fat and changes in the body hair. So whatever this, the development and the growth of the breasts are there during the puberty and the pregnancy time. Next, distribution of the body fat and the body hair, in that the changes can be occurred in the woman. These all the due to the estrogen hormone. Next role, that is maintain the bone density, and next one is the prevent the osteoporosis. Now osteoporosis is the one of the condition which is related to the soft bones, or bones can be easily breakable, or there the bone density can be reduced, and this is possible in case of men and women. So to prevention of this osteoporosis, the estrogen plays the important role. These are the physiological role. The first one is the development and maintenance of the female reproductive organs. It is responsible for secondary sexual characters in the woman, maintenance of the bone density, as well as it prevent the osteoporosis. And the last but not least, estrogen, it reduce the risk of the heart diseases. Means in the cardiovascular health also this estrogen play the important role. Now let's see the pathological role. This plays important role in the breast cancer. Next, it also plays the important role in the endometrial cancer. So in case of the high level of the estrogen produced in the body, it increase the risk of the breast cancer as well as the endometrial cancer. Endometrial, it is the inner lining of the uterus, mainly developed during the pregnancy time to hold the baby's weight. And if there is a imbalance or the high level of the estrogen or not balanced the quantity of the estrogen, maybe there are chances to lead to endometrial cancer. Next, it can increase the risk of the blood clotting, which can lead to the deep vein thrombosis as well as the pulmonary embolism. Now thrombosis is the blood clot in the vein, and the pulmonary embolism, it is the condition where the blood clot can be found in the arteries of the lungs. Means the arteries which can carry the blood from the lungs, in that there is a found the blood clot. Next, it is also responsible for the ovarian cancer. Means if there is a increased estrogen level, it also leads to increase the risk of the ovarian cancer. Next, we can see the clinical uses. Estrogen used in the hormone replacement therapy to alleviate the symptoms of the menopause, means where the to manage the menopause symptoms, these estrogen can be used in the hormone replacement therapy. Now the menopause, it is mainly occurred in the women after 55 to 65 age. In between that age, women can suffer or can show the different signs and symptoms such as hot flashes or vaginal dryness and the mood swings. So changes in the mood or any dryness in the vaginal part, these are the main characteristics of the menopause. And for the to treat that condition, these estrogen are used. Next, estrogen along with the progestin in combination, it is used in the oral contraceptives and mainly to avoid the unwanted pregnancy. These oral contraceptives are mainly used, which are the combination of the estrogen and the progestin.